Hello, I'm Dr. Michael Perlstein, a board-certified podiatrist and foot surgeon, and I've been practicing in Brooklyn for the past 20 years. And that means over 25,000 patients have benefited from my care. One of the most common problems that I see and treat in my office are bunions. And what bunions are painful areas along the side of the first metatarsal joint, as well as the fifth metatarsal joint. And when people walk in shoes or even barefoot, they have all sorts of pain and swelling and really are very uncomfortable. So when a patient presents with this problem, is I evaluate them properly. I see how they're walking, I see what happens underneath an x-ray as well as an ultrasound, and by evaluating the patient, we could formulate a very successful treatment plan. So if the problem is coming from the way they're walking and the problem is what we call biomechanical, then we could formulate a custom-made orthotic. It's put inside a shoe and the patients could walk relatively pain-free. However, if the problem is more advanced or has been neglected for a long period of time, the bone needs to be addressed surgically. And the way we treat that is by using something called MIS surgery. It stands for minimally invasive. So once the patient is either numbed up with local anesthesia or sometimes using IV sedation, where the patient is not feeling any pain or any touch whatsoever, we make tiny incisions. That means to you that there is less trauma and less pain and less swelling. We file down the bone, we correct the crooked toes that are there, we put in 1 or 2 stitches and the patient has a bandage and they walk home right after the procedure. The next day they are walking around and they're not feeling any pain whatsoever. There are no screws, there are no plates, and what that means to you is faster healing, almost no disability, and the patient is walking virtually pain-free. And as you can see from the patient I have here with these photographs, she had a bunion before, she had the minimally invasive procedure done, and she's very happy. She can wear almost any shoe that she'd like to wear and walk pain-free.
I went to see Dr. Perlstein because I've been dealing with painful bunions for something like 30 years, and I asked somebody who lives in Brooklyn, who do you recommend? And these were her words. She said, everybody in Brooklyn goes to Dr. Perlstein. So even though I live in New Jersey, I went into Brooklyn to see him, and I'm so glad that I did. Not only was he easy to deal with and knew a lot about my situation, but he immediately guided me to the right surgery for my feet.